Good evening. Thanks for joining us tonight, and thank you also to our KGMI listeners that are joining via radio. Welcome to another in our series of Whatcom County COVID-19 vaccination forums. Tonight, we're focusing on the efforts of some of those in our community who are doing the important work of connecting Whatcom County residents to COVID-19 vaccines. Our panelists this evening are at the forefront of these efforts. They, with many others in our community, are assisting those who experience difficulty in accessing vaccines, whether it's because of transportation, language, or mobility challenges, or simply because they don't have the information they need to find vaccine clinics and get vaccinated. But first, we're going to give you an update on vaccine availability and how we're doing to get our community vaccinated. We will be joined tonight, following this brief slideshow of where we are on vaccine, by Liz Baxter, who's the Chief Executive Officer of the North Sound Accountable Community of Health, by Nicole Fields, the Population Health Manager at Unity Care Northwest, and by Katie Zimmerman, the Program Administrative Support Manager at the Northwest Regional Council. So what's happening now? The day when those 16 and older are eligible has come much faster than any of us expected. That's a very good thing. If you're 16 or older, it's your turn. Tell your friends, family members, and coworkers that it's their turn too. If you've already started your vaccination series or are now fully vaccinated, congratulations. You've helped our community get one step closer to getting back to all the things we love about life in Whatcom County. Share your story about why you chose vaccination and about your experience. In the past several weeks, we've seen vaccine supply improve and become more consistent. There are now plenty of appointments and numerous places throughout Whatcom County to get vaccinated. We now have 2 community vaccination centers that are open to the public, both at Peace Health and at the Community Vaccination Center at Bellingham Technical College. Local pharmacies are also offering appointments, and some healthcare providers are also vaccinating their patients. There are many ways to get vaccinated. Make your vaccination plan, make an appointment, and get your vaccination as soon as possible. So in terms of how to get vaccinated, I mentioned lots of pharmacies and individual providers, also the Peace Health Clinic and the Community Vaccination Clinic are available for vaccine. With all these vaccine providers and plenty of appointments, you just need to know where to look to make one. It's best to start searching for a vaccine appointment on the Vaccine Locator website. This site provides information about available COVID-19 vaccine appointments from a variety of locations, and it links to provider sites for online or phone scheduling. It will also tell you which vaccine type the provider offers if they have uploaded that information, if there are appointments available, and when the information was last updated. There are also other sites to search for vaccine appointments, but we recommend using Vaccine Locator because it's the most reliable. If you have difficulty navigating the online systems, need language assistance, or just want to talk to someone on the phone, you can also call the Washington State COVID-19 hotline at 1-800-525-0127. Call takers can help you find an appointment and plan your vaccine. So in order to locate that vaccine provider website, it is vaccinelocator.doh.wa.gov. And if you're one of our listeners tonight and don't have a pen handy because you're driving home or not near a piece of paper, you can also do a search through the search engine, Vaccine Locator, Washington State Department of Health, and you'll be able to find that website as well. And I just want to once again share the Washington State COVID-19 hotline number, which is 1-800-525-0127, and that's an option as well. So I want to share a bit of data about where we are in terms of vaccinating our population. The data we're sharing here is from April 24th, so actual numbers as of today are higher. It's also important to remember that many of the vaccinations that have been given by our generous tribal public health colleagues at the Lummi Nation and Nooksack tribes are not reflected in this data because they use a different reporting system to that which is used by Washington State and all of the other providers. We are working to make those systems talk to each other and be able to report out all of those systems together. But at this point, this is really just what we're receiving that is going to our enrolled providers, pharmacies, and doctors' clinics, as well as the Peace Health Clinic and our community vaccination site. So while the numbers presented here underestimate that total because they don't include the Lummi Nation and Nooksack tribe and their generous contributions to our vaccination campaigns, they still show that we've made great strides in vaccination over the past months. After starting slow with limited vaccine supply, you can see that the number of people getting their first dose of a COVID-19 vaccine picked up, and we're approaching the 50% mark of first doses for the total population. For those of you who are listening on KGMI, we are at about 42% of all Whatcom County residents have received at least one COVID-19 vaccination shot. If we look at just the people 16 and older who are eligible for vaccinations right now, we've surpassed that 50% mark, with more than half of people, 52%, who can get vaccinated having taken that in first important step. And then when we look at those who are fully vaccinated, the previous gauges showed us how our community is doing at getting vaccines to people. This particular slide, which is the number of people who are vaccinated and the percentage of people who are vaccinated, this shows how well protected our community is against COVID-19. Think of this like a dial that shows us how close we are to getting to community immunity. Here we're looking at the total population, not just people who are currently eligible for vaccination, because having a high number and a high percentage of people who are vaccinated protects even the people who can't get a vaccine for medical or other reasons, who aren't eligible because they're under 16 years. Right now, nearly a third of all people in our county are fully vaccinated against COVID-19. We're at about 29% in Whatcom County. We want to see this dial get well into that dark blue range, which is over 60%. So we encourage you to get that second dose and get us to that target. It's really important for our community as we want to move forward in reopening businesses and keeping businesses open and making sure our kids this fall can go back to school full time, and by being able to return to the things that we love and enjoy about living in Whatcom County, and also, all of the fun social activities, events, concerts, etc., that we really want to return to as soon as possible, and vaccine will make possible. So I want to dig a little bit deeper into what we're seeing in terms of the population and the various age ranges, racial and ethnic communities, and our male to female ratio of those who have been vaccinated. We're tracking vaccination rates by age. As you can see on this slide, people over 65 who became eligible early on obviously have the highest rate of initiating vaccine. They are at 73%, those over 65. This is really a baseline snapshot that we will track over time. In addition, especially for those who are listening, or if this slide is small and it's hard to see these numbers, among those who are age 50 to 64, 52% have initiated vaccine. And among those who are age 26 to 49, they're also at 52%. Those 18 to 25 are at 35%. And age 16 to 17 are at 24%. We know that especially in those younger age ranges, the 16 to 25-year-olds, many of them were the last to become eligible the most recent to become eligible for vaccine. So we anticipated that those percentages would be lower, but we do hope and anticipate that those will increase as more time goes on. So we know that a person's race or ethnicity and the historical and current effects of racism have real and unjust impacts on healthcare and health. So it's important that we pay attention to and work to resolve inequities in vaccine access. What the data here tells us is that people of color in Whatcom County in general aren't getting vaccinated at the same rate as people who are white. There may be many reasons for that, and part of what we'll talk about later in this forum is the work being done to understand the reasons and the work being done to give everyone a fair chance at getting vaccinated. But as you can see on this slide, while the white population and the non-Hispanic white population represents about 78% of the population, they are tracking at a higher rate of vaccine, whereas among our Hispanic population, they represent 9.7% of our population, but only 5% of those who have been vaccinated. We also see this rate in a number of other areas in terms of our race and ethnic categories. Lastly, we're also tracking vaccination rates by gender because there are well-documented differences between males and females in terms of when and how often they get health care and access that. Females are more likely to access care, and we do see here that a higher percentage of females are getting their COVID-19 shot than males. Females are at 48%, whereas males are at 40% countywide, and that's for all ages. So, with all that data in mind, we're now going to pivot the conversation to talk with our panelists about their work in connecting people to vaccines. Thank you, Katie Zimmerman, Liz Baxter, and Nicole Fields for joining me this evening. I look forward to having a great conversation with you about the work that you're doing and all the impressive collaborations and efforts. I want to start, and I'm going to ask the first question to if Liz, you can start us off. Why is it important that we reach populations, ethnic and racial populations, populations who are seniors and others who may be vulnerable? Why is this work so important, both for your organization and for our community?
Great, thanks, Erica. Appreciate the question. The North Sound ECH uses a concept called targeted universalism, and it is a way for us to approach making equitable decisions and dealing with crises similar to the COVID pandemic. And what it asks of us is that we have a common goal. So in this case, it is to get everybody vaccinated to protect the population, but that you need to understand the specific circumstances, the assets, and the challenges within communities in order to have specific strategies that will work for them. And so a year ago, we saw that farm workers were having a hard time accessing the COVID testing. We worked with a number of partnering organizations who we're now working with again around access to vaccine. And since Whatcom and Skagit counties are both heavy agricultural areas, there are just a richness and some amazing organizations who work with and advocate for farm workers and their families that we've been able to partner with. And I often think that farm workers from the beginning and their families have been on the front line, kind of putting themselves at risk so that the rest of us could isolate and stay protected. But they're also at risk in other ways. They have insecure and sometimes unsafe housing. If they were getting a COVID test, that could put their job at risk. Now getting a vaccine, they don't always have paid time off. So their livelihood is at risk while we're trying to get them to actually follow all of the best practice guidelines. And we're not also very good at getting them the PPE and supplies that they need in order to stay safe. And so having them as, kind of one of the priority groups just felt really important to us.
Yeah, thanks for that, Liz. Could not agree more. So, Nicole, what are the specific populations that Unity Care is focusing on, and why is that so important to you and your mission as an organization?
Sure, thanks, Erica. So Unity Care is a federally qualified health center, and what that means is we're really focused on getting folks the health care that they need despite insurance status or income. So no matter your income level, you're able to come in and get top quality health care. That being said, we do have a lot of folks who are low income or racial and ethnic minorities. And we realize that the pandemic has really hit those groups, a lot harder than the general population, let's say. A lot of those folks are our frontline workers, they're in service industry jobs, and they're risking exposure every day to do those essential work functions. And so we feel like it's really, really important to get those folks in and also get them prioritized to get the vaccine. One of the first things that we did as an organization is we wanted to look at our data. So we wanted to take a look and see who is our patient population, and are they coming to us for their vaccines at the same rate? And one of the things that we identified is that our unhoused population, so our folks that are living, either on the street or don't have steady housing, were not able to get in as easily and weren't coming in as much for their vaccine, which is not a huge surprise to us, but we really were able to look at that data and then focus on our unhoused population and think to ourselves, how can we reach out to these folks and make it easier or eliminate some of those barriers in coming in to get their vaccine or going out to them and giving them their vaccine. So some of the strategies that we've taken is working with our community health workers to go out and do education in some of the encampments and with our community partners and just talk to folks and have those critical conversations about why vaccines are important and how it can protect you, and then offering those low barrier solutions to get in and get their vaccine. So offering vaccines at some of our community partner locations like Base Camp, and we're trying to do some additional pop-up clinics in the future to get folks in and come to them for that vaccine distribution.
Thanks, Nicole. It's just really, it's heartening to hear all the good work that different organizations in our community are doing. So Katie, I want to ask you as well, what is the role of the Northwest Regional Council in getting folks vaccinated, and why is this work important to you, and who are your target populations?
Absolutely. Thank you so much for the question and for having me. So the Northwest Regional Council, we are, among other things, the area agency on aging. So our population that we serve are the most elderly and disabled individuals in our community who are absolutely at the highest risk for really negative outcomes from COVID-19. When the pandemic first started and we started to learn more about the disease and who were really going to have the most struggles and the most difficult time through this period, we were very concerned for our population. And so throughout this time, we've understood that the folks that we serve need our support to get access. They often have lower access to technology, less assistance, fewer resources to get access to vaccines and even PPE. So we've been working hard throughout the entire pandemic to create ways for our folks to get access and to help now educate and get access to vaccines as well.
Great, great. So you're all doing such great work in our community to get folks vaccinated. I heard a bit from Nicole about some of the nuts and bolts work that you're doing to reach populations, but Liz, could you talk a little bit about the work you're doing with the ACH, and Katie a bit more about how you're specifically working to do outreach and create access and opportunity for vaccine. So I'll start with you, Liz.
Yeah, I probably should at least say, what is the ACH, which I probably neglected to do earlier. But, we are a nonprofit that was actually created by leaders from across the 5-county North Sound region with some intentionality around thinking strategically across jurisdictional boundaries and also across clinical and community needs. And our board recently changed our mission. So our purpose is to create a just and inclusive culture and the necessary conditions required for all community members to thrive. And so we move into work that crosses partnerships with hospitals, clinics, public health departments, community action, fire and EMS, and a lot of community-based organizations. We partner with all 8 of the tribes in the North Sound region. And one of our basic premises is that people who are impacted by a situation or a condition should actually have a clear say in strategies that will protect them or improve their lives. Nicole mentioned community health workers and promotorists. We have been building a fund to support that workforce, along with interpreters and navigators who speak multiple languages, who've been just incredibly essential in increasing access to testing and vaccine sites, creating spaces that are welcoming and understandable for so many community members, because not everyone realizes just how diverse some of the populations are in Whatcom County. People who speak Spanish as their primary language, or some indigenous languages from Mexico and Central America, Russian, Ukrainian, Punjabi, Hindi, and so many others. And so we're really good at doing things for the general population, but there are times when we also need to have people who can navigate what it's like for somebody where English is not their primary language to try and come in and access services. There's 2 things specifically that we've been doing. So one is that we've created a tool that allows community organizations to bypass the myriad online registration systems that require community members to have internet access for one, and the ability to navigate many, many new portals that have been set up to try and help people get to vaccine appointments. We have figured out a way to give them something fairly simple, where we then work on the back end to upload that information into those more complicated systems. We also have been working with some partner organizations. So here in Whatcom County, that has included Peace Health and Unity Care and CMAR and many others. And we're hoping soon we have a pharmacy chain who's been talking about partnering with us, but very specifically working with groups who have vaccine and are willing to set up dedicated blocks of time and specific appointment slots for the ACH, where we then in turn work with organizations like Community to Community Development, LETI, the Latino Education Training Institute, the Farm Worker Center and Catholic Community Services, and others who work with migrant and immigrant communities. Just the notion that they actually get to step in and play that direct role, working with community members who trust them, who understand them, so that they can step in and navigate getting folks access to vaccine, has been just a really important part of our work in the last 3 or 4 months.
Yeah, thanks for that, Liz. And I can say on behalf of the health department that we so appreciate your partnership and your leadership in making sure that equity is a prime and critical piece of how we distribute vaccine in our community. Thank you for that. Katie, I'd love to hear a bit more about how you're working to serve our senior population and those that serve them.
Absolutely. So, as I said, we serve, the most vulnerable elderly and disabled people in our community who are mainly on Medicaid long-term care. So that would make them essentially able to check themselves into a nursing facility and receive nursing facility level of care, but they're doing so in their home by choice out in the community. So each of them, or in some cases, depending on the type of program they're on, they are using either an individual home care aide who is coming to their home to provide that in-home personal care daily, or they may be using a home care agency. So through that, we really had 2 populations to serve. Initially, right off the bat, with vaccines becoming available, our population of clients was not eligible to be vaccinated. the caregivers who come in to help them were 1A qualified providers. So immediately, if we can remember back to the beginning of the vaccine rollout, it was really difficult for people to get access to the vaccine. And we knew that the way that we could protect our clients was by protecting the caregivers who were coming into their homes, who were really probably a primary way that they may be exposed to COVID-19. So we worked immediately to do outreach and identify who those people were, individually calling each of the individual providers in our 4-county region, especially Whatcom and Skagit, where we knew people were having a harder time getting access at that time. Helping create access points to the hospitals in both Whatcom and Skagit counties, but specifically partnership with Peace Health, which has been instrumental to us getting access for all of our populations. So, really helping those people understand they were eligible in some cases, to identify the number of home care aides and our clients in the community that would need access to vaccine, because it is a lesser known population, and then getting that access for them and really doing a warm handoff, getting them to Peace Health in Whatcom County, getting them, access to certain vaccine clinics to get that taken care of for themselves. And then we continue now to be available to help. We've also, our Aging and Disabilities Resources line, which is part of the other services that we provide at Northwest Regional Council, has been helping people who have no access to technology or who are unsure of where they may go to get a vaccine as well throughout this period. So really directing and in some cases registering people who are not our current clients, helping them get access to the vaccines.
Great. Thanks so much, Katie. Really helpful information and just great work that you're all doing on behalf of our seniors and our most vulnerable seniors as well. So one of the, we've been through, as I don't need to say, we've been through a very difficult year. Everyone has. And vaccine certainly for all of us represents a change, an end to the pandemic, a return hopefully to a better than what was normal before, and some hope. And hope springs at this moment as well. And I'd love to just take a pause and ask for you to share any of the success stories or anecdotes that you're hearing that really highlight how important this work is. And how helpful it is to our community. So if you have any anecdotes or stories, I'd love to hear them. And please pipe up whenever appropriate. We can start with any of you.
I would love to tell a story.
Do. Yes, do.
Aside from those first few weeks when we were vaccinating a lot of our older adults, and we had people bringing us like hand-knitted pot holders and just the sweetest gifts. But I want to talk specifically about one of the vaccine clinics we did with a community partner organization. So it was a pop-up clinic. We weren't at Unity Care. And we had an open vial of vaccine and needed, a couple more people to get doses so that we didn't waste that vaccine. And so I was kind of walking around and went out front of the organization and asking people if they had their COVID shot yet, or if they were interested in getting vaccinated. And I walked up to one lady and I said, "Are you interested in getting your COVID vaccine?" And she said, "Absolutely not." And I said, "Can you tell me a little bit more about why?" And she said, "Well, my boyfriend told me that I'm going to die if I get the COVID vaccine because I have all these other health conditions going on." And it really provided a chance for her and I to just have a conversation and dispel some of those myths and talk a little bit more about why the vaccine is important, especially if you have these coexisting conditions. And she kind of looked at me and said, "You know what, I think I'm going to do it." And so we walked in together and we walked in back together, and she sat down in the chair, and right when she sat down, her phone rang, and it was her boyfriend telling her, "You're going to die if you get this vaccine." And she kind of looked at the phone and she said, "I'm going to do it anyway because I believe in this science, like this vaccine." And it was so powerful to just see her courage and the way that she kind of believed in making, putting an end to this pandemic, and kind of saw the value in protecting others around her. And gosh darn it, she got that vaccine, and it was a fabulous day for me.
Wow. Yep, one at a time. One at a time, Nicole. Thanks for sharing that.
I guess I feel like I would probably want to start on one end and go to the other end. I think that it's really easy to lose trust, right? So, a lot of what COVID response has asked of public health and of others is to be trustworthy, and it's been hard. So, I think of the calls that we get of whether they're farm workers or anyone else in the community, where they go to a vaccine site and they don't feel welcomed. They don't feel like someone is treating them with respect or with dignity, and what that means for what they will say to the next person that they speak to when they step away. And then I hear, folks, again, probably from community to community, talking about a clinic site that we worked with the folks from Peace Health and the county and others, where one experience with a farm worker walking through a clinic site and feeling that sense of belonging will bring 5 farm workers the next time that clinic site is open. And just trying to invest in the resources, which for the most part are people. It's how do we as people work together to create those sites that make someone feel like not only are they welcome, but somebody cares about them and wants to be protecting their health. Massive difference in just, impacting the next people who are going to come in the door.
Mm-hmm. Yeah, thanks for that, Liz. We talk a lot about cultural competency and linguistic competency, and that's a perfect example of how that in action creates change in an entire community. So thank you for that example. Katie, any stories or anecdotes you'd like to share?
Yeah, absolutely. So, we are individually calling out to our clients, the people who support them, both the paid caregivers and in some cases unpaid family caregivers as well, who are part of our family caregiver support program. And, when we're reaching some of these people, it's like they won the lottery. They don't know that we're going to be calling. They don't know how they're going to be able to get the vaccine. I just imagine, for some of our clients being at home, knowing that you're in the highest risk population, not knowing how you are going to get to the appointment, you don't have access to technology to make your own appointment, and getting a phone call out of the blue, someone saying, I would like to help you get signed up right now to get vaccinated, get this started for you, and then help you find a way to be transported to the vaccine site. So we're getting lots of, very excited responses that people are so thankful that we're helping with this. But additional to that, there are the people who we talk to who say, okay, sure, I guess since you're calling me, I'll go ahead and take advantage of this. I don't know if I would have gotten the vaccine if you hadn't called me right now. And those are the ones that we really celebrate, because we think, okay, we've made a true change for someone there who probably wouldn't have, struggled to find out where to register, how to get to the vaccine site, the people that likely would not have been vaccinated in the near future. And because we were there able to help get that access, we've really, impacted that person and the people that they're exposed to and the people that they serve or are served by them. So is really, those are some of the best successes that we've had. And I know for a fact the first day that we were getting calls out to clients and clients were accepting back in January and IPs were accepting back in January, I was like over the moon ecstatic that, we are doing something positive to impact the recovery from this pandemic, to pull out of this pandemic after what felt like a year of absolutely just, responding to the next wave of who knows what's going to happen. This was a really positive step forward. So feels good.
Yeah, absolutely. And I think about our our seniors, especially those who have limited ability to get around, have limited access to others, and how hard that must have been on so many of them to not have social interaction. You know, my parents are pretty busy and active people, but to be able to hug them for the first time in over a year last weekend was really special. And now that we're all vaccinated, we can see each other again. And I know that there's lots of family stories like that where they're finally being able to reconnect with parents who are seniors. And it's just, it's great to hear. And I really appreciate all the work you're doing on behalf of this population. Thank you for that.
Thank you. Yeah, I did neglect to mention that we're working as well, specifically to identify homebound individuals around the county who are homebound not only mobility-wise, but transportation access is an issue, or perhaps there's mental health or physical challenges with waiting in line or going to a vaccine site. And so that's another huge piece. We've partnered with the Whatcom County Health Department, and that is an incredibly rewarding part of the process as well, to be able to get it for those people who truly don't believe they have a chance to get vaccinated.
Yeah. Thank you. There's a lot of heart in this work, and it's nice to hear the stories as we see an end to this. So, from your perspective, and I'll start with Nicole on this. From your perspective, where are we in our vaccination efforts, and what work remains to be done?
Yeah, thanks for the question. I think you showed some great slides on the data about where we are and how many of our residents in Whatcom County have been vaccinated. From our angle, it seems like we're kind of hitting that saturation point of the folks that were vaccine enthusiasts, like those folks that were knocking down the door, ready to get a shot in their arm, absolutely excited about the COVID vaccine. And now we're kind of left with three groups that we want to redo. The first being folks that may have some additional barriers to getting that vaccine. So, you know, either there are some transportation barriers, language barriers, workplace barriers that have prevented them from coming in to see us. And that's one of those things where we certainly want to look at how can we bring care to them. The other group would be those kind of vaccine neutral, like Katie mentioned, that aren't going to be knocking down our door, but if we call them and do that outreach and provide a little bit of education, they might end up coming in and saying, okay, yeah, I'm ready to get the vaccine. And then we have our folks that just are not interested. And so I think that those are kind of the three groups that we're in right now, and we have to figure out different strategies to target each of them. So I think that education will be important, but also looking at our data like you showed and seeing, all right, our non-Hispanic white population is doing pretty well at getting vaccines. But other populations like our Latinx and our unhoused folks are falling behind a little bit. So what strategies can we use to outreach to those folks specifically and either do education, mobile vaccine clinics? How can we get the word out and make it the easiest possible choice to get that vaccine?
Mm-hmm. Yeah, thanks. There's certainly conversation at the health department about what does it look like to move from a mass vaccination campaign to something much more targeted, labor intensive, but really reaching the populations that are most at risk for severe illness or death, or who have the most barriers in order to be vaccinated. So yes, I know those conversations are happening, and appreciate your thoughts on that as well.
And
Katie,
if I can add,
oh, of course, yes.
We're really excited that we just got a grant to bring on 4 vaccine outreach specialists that are going to be working to target some of those specialized populations, doing that targeted outreach and getting the word out that they can come to Unity Care for their vaccines.
Yeah, great. I can also share that for almost a year, we have had a partnership with Unity Care and have had 2 community health workers, Indian Fighter, joining our team doing case and contact investigations and quarantine and isolation support. And I know that they're returning to Unity Care next week to help with these vaccine efforts. And we've really appreciated having them, but we know that they will be put to good use to make sure that we're reaching our target populations for vaccines. So yeah, it's a great partnership. So
Yeah, thank you.
Yeah. So, Katie, where do you think we are in terms of the populations that you have targeted? Where are we in terms of vaccine, and what work remains to be done with our seniors and caregivers?
Thanks. Yeah. I echo kind of what Nicole was saying, that we're reaching near that saturation point of the people who were immediately wanting to get vaccinated. So we continue to call through. We're wrapping up a couple of our programs, calling through our individual clients and caregivers. And, what we're finding is in the beginning, it was like a third of the people had already been vaccinated. A third said, yes, please help me. And a third were declining or hesitant, some for medical reasons, some of those hard no's, like, no, I'm really not interested. Now, as we're working through this later stage, we're finding that about 50% of people have already been vaccinated, which really speaks to the better access that's out there in the community right now. But there are still 10 or so percent of the people that we speak to who haven't been able to find their way to getting access to vaccines. So we continue that work to gather those folks up in the last rounds of calls with our populations. But for the people who have said no or are hesitant, or the folks that we haven't been able to reach because some people aren't answering their phones, we do plan to do a letter campaign mailing to those people to provide some education, some materials that we've worked in partnership with the Whatcom County Health Department, and to also provide education on what to do after you have been vaccinated, what you can safely do, and how you need to continue to protect yourself and people in the community. So that's our next round, is to kind of reach out by mail, try a different kind of communication strategy, and then we're looking at other ways that we will person to person reach out to provide education. So it feels like we've been through the first round, but it's time to move on to that harder work of the people that are not quite sure yet.
Yeah. Great, thanks for that. And I know that, Liz, you saw the slide that shows how our Latinx population is about 10% of our population, and have only about half of them, 5%, have initiated vaccine. So I know there's work to be done in that population as well. Can you speak to sort of what you think are the next steps, or what the efforts are moving forward?
Yeah, thank you. I have kind of a hodgepodge of things, so I hope it makes sense when I get done. I think that within vulnerable communities, we have a tendency to rely on volunteers to do work, and not thinking about, again, going back to community health workers and promotores, interpreters, like how do we actually financially provide support for them to step in and help with some of this work. Both Nicole and Katie talked about like the folks who've shown up so far. And, but we have to also know that the people who've shown up so far had time during the day responding to the messaging that we have used so far. And I think that there are people who actually want to be vaccinated who don't think we're speaking to them. They don't see themselves in the messaging. And so I totally agree with how they both described some of the next steps. But I think that we also need to think about how we actually go to communities, work with community organizations, and perhaps use some different approaches with them. Getting clinics to expand from being just during the day, during the week, sounds like it would be something that would be like easy. But, Erica, because you've been in these conversations, hard because it requires people. It requires staff to staff those things in evening hours and weekend hours. But if we're going to reach those additional populations, we have to figure out how to have evenings. Saturdays are easier. Sundays are harder. But if I, again, focusing on the farm worker community, they're working 6 days a week. they're working into the early evenings. If we want to do a clinic or a pop-up clinic that's accessible for them, we have to be thinking outside the norm of how we typically do things. The other thing that comes to mind is, like, we're really good at speaking what my son always referred to as healthcareese and bureaucraties. And so, like, how do we get information out from people that communities know, that they trust? How do we put some of this in plain language? We sometimes assume that if somebody's not ready to go, it means we have to give them more data to show that, they should do something. When they may not be looking for more data, they may just be looking for somebody who will speak in a way that they can actually understand and digest. And I think that just, that's a very collective, it's not on you, it's on all of us, to speak in a way that communities can understand. Mm-hmm. From the ACH perspective, we have been operating for about 6 years, and part of our goal is to have the back of public health. And, we look at what health departments have been doing, not only during this pandemic, but before, and what you're responsible for after. And so we point people to the health departments in their jurisdiction for, like, what's the good information? How do they learn? How do they know what the guidelines and criteria are? But at the same time, we're also working on behalf of community voices. And that sometimes means that we are nudging or pushing or advocating for things that our clinical and community partners, like, don't think they can do. And I have an appreciation for being in a region where I can be on a call with the health department leaders and push for things that folks are going, like, we just don't have the ability to do that. But knowing that there are community organizations ready to step in and help, it makes this a very unique place to be trying to address a crisis like COVID. If we just know that nobody's going to do this alone, we're not going to solve this alone, but in partnership and leaning on people that communities trust, we'll get further than we would alone.
Yes. So many important points there, Liz. I actually spoke with a group of fourth graders on Monday night and had to try to think about how to revise my language and not use words like epidemiology and interoperability and all of the other sort of public health terms that just get lost in the mix and in the fray. And thinking about that, even when you talk about populations where English isn't their first language, or don't sort of understand or really care all that much about the work that we're doing and the data that we provide, but what we can do for them and how we can help them, right? Or how they can be assisted. So just really important points. And I've appreciated both your fierce advocacy for public health and your quiet whisperings of how we can improve. It's been helpful for us, both before COVID and during COVID as well. So just thank you for that as a partner. So we've talked a lot about what we're doing and what you all are doing, but what could the average person do, or what could people in our community do to help our local vaccination efforts? We really want to reach those targets. We want to reopen our businesses. We don't want to move backwards. We want to move forwards. We want to have, we want our clicking refresh to be to go see a Beyonce concert, not to be getting a vaccination appointment. That we want to go back to the things that we love and enjoy and be able to see our friends and family again. So what is your advice? What are your recommendations for people in how they can help with these vaccination efforts? I will start with Katie.
Sure. I think you saw me smiling. For specifically to our population, but I think true of anybody, really check on your neighbors, talk to your friends, share your story of why you chose to get vaccinated, and think about maybe the people who either haven't had the ability to get access or maybe don't know what to do, don't have the technology, and can use the help of somebody who can click the refresh or just know where to go. So really, it's going to be a community effort, I think, to get us over the last of this pandemic. And we all need to support our friends, our neighbors, maybe your neighbor down the street that you don't know that well, who is, elderly and needs that support, helping to make sure they have what they need to stay safe, but also to know that people care about them and want them to get vaccinated, want them to be protected as well during this pandemic. I think that's something that everyone can do, for the humans that we share this town and this planet with. That's the most care that we can provide.
Now all in this together, and what a great message to be thinking about how we can make sure that we're checking in on each other and helping those that may not have that access. So Nicole, what would you say the average person could do to help our vaccination efforts? Do you have thoughts on that?
Sure. I completely echo what Katie mentioned about not being afraid to have those conversations and check on your friends and neighbors. I think this is a wonderful time also. I'll say I got the Moderna vaccine, but I would have gotten any of the 3 vaccines that were offered to me. The right vaccine is the vaccine you can get. They've all been proven effective, and I think kind of reinforcing that conversation is going to be so important moving forward. I got my vaccine so that I could protect my family, my health center, my neighbors, and contribute what I could to reopening the community. And those are all things that I can share with people about why I got the vaccine and kind of help them learn their reasons why they might want to get the vaccine. Also, I want to throw in, and this is not my phrasing, so credit where credit is due. This is from Jason at Northwest Youth Services. It came up in a conversation we were having today about how we can best become an anti-racist organization. And he had a phrase that I really liked, that it's about learning and action. And so thinking about how we can apply that to vaccine equity is going to be critical. We have the data now. We can run reports all day long and look at who's getting vaccines and who's not. So what is the action we're going to take to close that gap and ensure that equitable access?
Yeah, thanks for that. Yes, well, we may not all be experts in vaccination. We are experts on our own experiences, and certainly sharing those with friends and family could help make the difference in whether or not they decide to become vaccinated themselves. Great example. Liz, any closing thoughts about what we can provide advice for people to help our vaccination efforts?
Yeah, one of the things, and I have 3 adult sons, and my middle son isn't planning on getting vaccinated for another year or 2, is what he most recently told me. And I think that we need to do exactly as Nicole and Katie mentioned. Like, we need to talk about this. We need to normalize talking about it. And maybe we all need to talk to somebody who's reluctant. We think about it as vaccine hesitancy, but we're battling a 24-hour news cycle that sometimes has 24 hours of just like gibberish. And, but that's what our young people are hearing. We hear from our tribal partners at Lummi that they're looking for communication strategies about reaching young people. And I wonder if learning small history lessons would be helpful. This is not the first time that a pandemic has hit this globe. And I'm sure that whether it was influenza or smallpox, there were people who didn't understand. And I'm hoping that it is people in communities talking to people that they trust that ends up making the difference. But I'm going to let all of you know when my son decides to get vaccinated, because I'm working on him pretty hard these days. But I haven't found the magic thing. But as long as the door remains open to keep talking about it, I'm considering that a success at this moment. But if I wasn't talking about it, I could make a lot of assumptions about him. And, I think we just need to know people are in different places, and more we talk to them, the better we'll all be, because it's going to take us all to get past this.
Yeah.
And
Yeah.
Erica, I'd be remiss if I didn't just say, just to really appreciate your leadership, the county's leadership, because it hasn't been by doing nothing that we've gotten to where we are around vaccines. So just, appreciate that and all the partners that do the work that they do.
Thanks for that, Liz. Shame and judgment do not get us to our goals. Understanding, empathy, and compassion do. And while I work in public health and care very deeply about this work, I also have a family history where my grandmother was in an iron lung with polio for 9 months and was permanently disabled for the rest of her life. And my family shares that experience and shares the value of vaccine and the miracle that vaccine became for people who had suffered from polio or were at risk of suffering from polio. So, I think there's a lot of, like you said, family stories or history that hopefully can apply to our thinking around this vaccine as well. And really thinking about it in terms of protecting those who we want to be around who are more vulnerable, not always just ourselves. So with that, thanks so much. Oh, what a great panel. What a great conversation. Really appreciate your time this evening. I want to share a couple last slides that has a bit more information about our presenters. So Northwest Regional Council can be found www.nwrcwa, like Northwest Regional Council, Washington.org. The North Sound Accountable Community of Health at northsoundach.org, and Unity Care Northwest at unitycarenw.org. And for more information about the COVID-19 vaccination, again, I shared this in the beginning, visit whatcomcounty.us/COVID vaccine, or go to www.doh.wa.gov/emergencies/COVID-19/vaccine, or probably more easily, you can just do a search engine search for COVID-19 vaccine at Washington State Department of Health. So those are a few resources for you if you'd like to learn more and understand a bit more about vaccine and the myths and the facts about the various vaccines. Again, thank you all for joining us, either during this live broadcast, watching later from home on YouTube, or listening in on KGMI tonight. We appreciate your time and your interest in this topic, and we look forward to sharing more information with you next month at our forum in May. Thank you and good night.